So in older cats, sometimes they were reluctant to get up and down off counters, and notice they won't be on couches, or if the bowl's above the floor and you're trying to keep it where a cat can't, or a dog can't get at it, sometimes they'll have trouble getting up there to eat. So what I've noticed is, in some cats, we're doing a disorientation exercise. I know, there you go. Didn't work. And so what you can feel with your cat is you might feel along the back. See that? We're not happy, are we? I know. Ow. Is that hurt? It hurts. Show the camera. So I got my thumb on one side of the spine, my finger on the other side, and I'm just squeezing, and you can tell there's a lot of pain there. That could come from inside. The kidneys could be putting pressure if they're inflamed or infected. The muscles could be sore if there's a pulled muscle. But in cats, a lot of cats, it's actually an arthritic condition in the vertebra where they get arthritis, and the nerves that go to the muscles are irritated, and the inflamed joints of the vertebrae are also get irritated. So in cats, sometimes we'll use a low dose of cortisone to make that back feel better, and usually you can treat cats like this off and on with low doses of cortisone.
Just a little bit. Okay, good kitty, good kitty.
Cats never like to be x-rayed.
Clear.
Okay. I know, sweetie.
Clear.
Sometimes the x-ray will show us a lot, and sometimes it won't show us that much. If we follow the spine around and along, we're looking for narrowed spaces between the vertebrae, and we're looking for any arthritis we see below those spaces. And in this case, we really don't see significant ones except for the very end in this lumbosacral junction, our lower back, and the cat's lower back. There's quite a spine there, quite a sign, not a spine, but a jagged piece of the arthritic joint. So if we follow the spine along also, we'll see that most of the spaces are very evenly spaced, very horizontal-like, parallel. And then in some of them, they almost get A-shaped. And it could be that those spaces are narrowing at the top and pressing on the nerves from the spinal cord and causing the pain. So I don't see any real arthritis here, but I do see some abnormally shaped disc spaces. And I know that a lot of cats just suffer from back pain, so that could be the cause of the pain in this cat. So, well, back pain in cats is pretty common, and often a cat becomes reluctant to jump up things like they used to. My cat Norman won't jump up on the counter to get his cat food. I actually have to lift him, or let's put it this way, he wants me to lift him up. He can jump up there because when I'm not there to lift him up, he'll go to the cat bowl quite well. But he goes to the kitty gate, because we have a gate to keep the dogs out of their room, and he looks at me, and then he goes over the counter and looks at me again like, come on, lift me up. I don't want to get up there to get my little bit of dry food and wet food that I put down for him twice or 3 times a day. My cats are spoiled. Anyway, I hope you enjoyed it, and if you get a chance, check out Dog Dish Diet also. Thanks so much. Have a great day.